Good afternoon, everyone, and thank you for joining us today. On behalf of Roundabout Nursery, I am delighted to welcome you to this special session where we will be diving into important conversations about mental wellness in children, parenting challenges, and how we can better support emotional well-being in early years. We are truly honored to be joined by Dr. Kiran Najabat, a consultant child and adolescent psychiatrist and the founder and director of the Family Wellness Practice. Dr. Kiran has led remarkable work in the field of child mental health. She and her team have trained over 5,000 staff, parents, and students across schools, nurseries, orphanages, and healthcare settings. She is also the creator and lead trainer of over 10 CPD accredited courses covering a range of key mental health topics, from building resilience to navigating self-harm and suicide prevention. Work that has earned outstanding national and international recognition. Today's session is part of meaningful collaboration between Roundabout Nursery and the Family Wellness Practice, with a shared goal of improving mental health awareness and support across childcare settings. During this session, we will be exploring practical ways nurseries professionals can identify early signs of emotional distress in children, how to engage families effectively, and how to look after their own well-being in a care environment. We will begin by asking Dr. Kiran some key questions submitted by our MRN team, and we will keep some points towards the end for a few follow-up reflections. Dr. Kiran, thank you so much for being here. It's a privilege to have you here with us today.
Hi, thanks Patricia for the kind introduction. So I have spent the last kind of 10 to 15 years as a psychiatrist in various aspects of managing children's mental health and well-being, both in the NHS and in the private sector. I mainly see children that present with difficulties regarding their attention, concentration, behavior, sleep, mood, lots of different kind of mental health difficulties. And it's usually in children aged between 5 and 18 that I see, because children under the age of 5, we expect for their stage of development, there may be challenges and difficulties that they're showing that is actually within their developmental expected stage of development. So we try not to kind of worry too much in assessing children under the age of 5, because we don't want to kind of give them a label or a diagnosis at such a young age, knowing that, you know, some of these challenging behaviors that they may show at that age, they'll grow out of. It's what we expect in the standard developmental stage. Whilst I have been doing my private clinic, I have also developed CPD accredited training and courses and workshops for staff, students, and parents within schools and also within nurseries. And that's what I feel kind of very passionate about. So today we're going to be talking about managing challenging behaviour in children. I'm going to focus on mainly the nursery age group under the age of 5, because we see different difficulties at different stages.
Yeah, so thank you so much. And I did enjoy the trainings. I can recommend them to everyone.
Thank you.
But can you tell me what are the challenging behaviors and what are the triggers, the signs that everybody could be kind of aware and be able to spot?
Sure. So first of all, I think it's important to talk about what actually challenging behavior is, because to some people and to some parents, challenging behavior might be a child, crying 3 or 4 times a day. Whereas to another parent, it might be a child that is screaming, shouting, hitting, lashing out, both at home and school for long periods of time. So as you can see from the 2 examples that I've given you, you know, one is probably just showing a normal range of expression of emotions through crying maybe once or twice a day. Whereas the other one, the increase in duration of the crying and the, disruptive behavior that they're showing is at such a intensity and frequency that it's actually impacting the child's well-being. It's impacting the relationship between the caregiver and the child, and it may even impact the nursery environment that they're in and their behavior and interaction with other children. That's what I would define as challenging behavior, because it's to such an extent of intense frequency, duration, and intensity that is impacting the child's well-being, their relationship with others, and also even possibly their own safety. That's what we define as challenging behavior. So your next question was, what kind of challenging behaviors do we see?
Yeah.
Is that what
Yeah.
you were asking
Yeah.
about? Yeah. So, in terms of the main types of challenging behavior that we see, the ones that I think impact nursery and school environments are where the children act out. So, we call acting out behaviors where they may be crying, they may be shouting, biting, spitting, hitting, throwing things, even destroying property. This can be very challenging both at home and at nursery or at school. But we can also see other behaviors as well that can be quite challenging, where some children may not act out, but they actually withdraw and they
Mhm.
become very quiet. They become quite socially isolated. They may not want to follow rules that they're being given at home or within the nursery environment. And that can also be quite difficult to manage because if they're quite rigid and they're not managing the changes that are expected of them, then that can also be seen as quite, difficult for nursery managers or for parents to be able to manage at home and within the nursery environment. So it's very important to kind of really understand why it is that the child is displaying this behavior.
Could you tell us how effectively we could manage those behavior and how we can learn and understand?
Yes. So, in terms of managing behavior, what we need to really understand is because with any type of behavior that a child actually of any age shows, is they're trying to communicate. They're trying to communicate a need that is unmet within them. So, whether that be, so the younger the child is, the more difficult it is to verbally communicate. And that's why we often see a lot of acting out on what we call, the terrible twos, the tantrums that they may have, where they're rolling around on the floor, or they're kicking their legs, or they're shouting. This is what we expect a 2-year-old to show.
Yeah.
And even up until the age of 5, 6, 7, you see these tantrums. So we often need to understand what is the child, or if it's the parent looking at their child, what is my child trying to communicate? Now, what lots of parents, me included, tend to do is if we're already exhausted, for example, from our day at work, we're already feeling quite, stressed out because we've got lots of things that we need to manage after work with the children at home, for example. Our patience can be quite low. And what we tend to do is we may react to the child and become quite snappy or, become very quick at responding to them in an equally as aggressive way. So, for example, our tone of voice might increase. We may start shouting back. And what that does, as you know, to the child,
Triggers them.
they will mirror that and they will
Yes,
copy that and then
exactly.
they will do the same thing. So, it's really important, not just as a parent, but as a caregiver within a nursery setting. Everybody's human. Our own patience gets tested. What we need to understand is what is going on for this child, taking a step back, really questioning what could be triggering the child. Is it that they are feeling unsafe? Is it that they have not had enough sleep last night? Is it that they're feeling very tired because, they are generally not feeling that well that day? Is it that there's any changes going on at home? Is there some kind of, new sibling that's arrived that can cause, a child to be quite anxious and to make them feel quite worried when they're separating from their parent? So there's lots of things. They could be hungry. There could be not, you need to look at each individual child. It could be that some children need more stimulation than other children. And actually having lots of screen time can make them feel quite aggressive and can cause them to act out and show challenging behavior, especially when you put demands on them to stop doing it, for
Yeah.
example. So these kind of things we need to look at. What is it that the child is trying to communicate? What is it which need is not being met? And how can I, as their parent or as their caregiver, take a step back, remove myself from the situation emotionally, and actually respond to the individual child's needs? So I think it'd be quite good to think of an example, actually. Is there any example that you can think of where a child shows challenging behavior within your setting?
I think one of the popular ones would be when child is demanding something at the time that it's not appropriate. So let's say it's time for a lunchtime and child wants to go outside and play in the garden, and we explain the routine. We say why we create environment, and child is adamant. There's lots of meltdown, crying, persistence, explanation is not working, showing the routine is not working. So what would you do in those cases?
That's quite a tough one, actually. So you've already given them, the visual timetable. You've already shown them what the expectation is. Now, I think it also depends on the child's temperament themselves. So some children generally tend to be more rigid, more difficult, demanding, and they can not respond so well to larger environments where there's quite a few expectations on them. So it's really understanding what are the needs of this child, what is the temperament of this child, and how can I, within my setting, obviously having a larger group of children with you that you also have to meet their needs for as well, how can I adapt my style, my teaching style, or my, environment to help to suit the needs of this particular individual child? So maybe it could be, for example, having a meeting with the parent and the child and yourself just to go through at these particular points in the day, this child is really struggling. What could be the reason why they're struggling at those particular times of the day? Why is it that they're finding it difficult to meet the demands? It could be that actually they're quite hungry, but instead of saying, I'm hungry and I need to go and eat, they still want to carry on playing because, as you know, with children, they don't necessarily know or when they need to kind of, go on to the next activity or the next part of their routine, even if they are given that guidance. It could also be that within the home environment, there isn't that expectation on the child to have a specific routine. It could be that the child is a bit like the boss at home, and the child is actually dictating to the parent that this is how I want to do things, and I'm going to have my screen now, or I'm going to have my playtime now. And a lot of parents, especially when children are babies, I know there's a lot of kind of child-led parenting where, especially when it comes to feeding and eating, the child dictates when they're hungry and when they need
Yeah.
things. But we know that evidence shows that routine and having those expectations both at home and at nursery makes that transition from home to nursery and school much easier for the child. So it's very important as parents, I think, to make sure that there is a routine, especially if you want your child to get on easily at nursery and at school, to try to align with the routine that is being shown at nursery. So that then if you've got that same environment, not environment, but that same kind of routine at home, it makes it easier for the child to manage within the nursery setting. Does that make sense?
Yes, that's what
But
kind of led me to ask you the other question, which was how
yeah,
important is the routine? Because in the nursery environment, we
yeah,
know the routine is something that guides the child throughout the day, and we know that the child knows what is expected after the other thing, and the predictability
exactly.
is very important for children. So could you give some advices to our parents how they can maintain good routine at home, and why is it really important in that?
Yeah.
Yeah.
So this is absolutely crucial, actually. I think this is the main reason why lots of parents come to me pulling their hair out practically because they are so stressed out by the child's challenging behavior in response to trying to meet demands that just basic demands like going to sleep on time or eating on time. These are very common challenges that I see children under the age of 7 for. Parents will come to me and say, my child isn't sleeping very well. I spend literally most of the evening just trying to get them to go to sleep on time. So it's really crucial that every child has a set routine. And actually, some children need that routine and that structure to help them to regulate their emotions, to manage their emotions. And what you will find as parents is that if you do have that routine in your life, it will make your life easier, and it will reduce the child's challenging behavior as well. So, for example, but obviously there needs to be some fluidity and flexibility because obviously there's other children in maybe in the house. They need to adapt to the parents' working demands as well and the nursery or school routine. So I understand that there needs to be some flexibility about it. But if we use the bedtime as an example, a lot of parents, they don't mean to do this, but they may give the child access to devices or screens, which can make them be quite overstimulated after 6 or 7 p.m. And then what happens is that has a knock-on effect on their behavior because they're already kind of overstimulated from the screen. And then I see lots of parents will come to me and say the child is showing really disrespectful, quite challenging behavior where they're lashing out on the parent, regardless of the age, actually. The younger the age, they may act out through tantrums. And the parent doesn't know what to do because they don't want to make the child more angry and more upset. So they don't, some are too afraid to take the screen away from them
Yeah,
and to put a stop
that's the
to it.
scary part. Yeah.
Exactly. But if beforehand there is this clear expectation, okay, you tell the child, even from the age of 2, that these are the rules. The rules are you get half an hour or a maximum of, I would say half an hour to 45 minutes of screen time after nursery. But you have to have your dinner first. And whatever that dinner is or tea is, they have to have that first. And they need to try to finish it and then they have the screen time, or you say it doesn't matter how the parent wants to do it, or they have the screen time first and then dinner, whatever works for the family. The point is, however the parent is going to manage the routine or the expectation, it has to be very clear and it has to be followed through. Children do not take parents seriously if the parent says you're only allowed half an hour of screen and the child is still sitting on the screen an hour later. They will not take the parent seriously. What the parent says and what the parent does are two different things. If the child is seeing that my parent is not following through with what they're saying,
Yeah.
that has more of an impact on the child's behavior than what the parent does has more of an impact on the child's behavior than what they say. So there needs to be very clear expectations. We're going to have half an hour of screen, then we're going to have dinner, then we're going to have bath time, then we're going to have a story, then it's bedtime.
Yeah.
And then, there's no overstimulation. If they try to come out of their room, you take them back into the room. It's not right. Now you can come into my room for half an hour, then they want to come downstairs for half an hour, then they want to go into another room. No, it has to be, these are the rules, these are the expectations. And it's really difficult for some parents that are so exhausted, they don't want to have to keep taking the child back into their room because they're tired. And I get it. And that's fine. We're not perfect. We can only try our best. It's okay to let your child come into your bed or, come downstairs once in a while. But the routine regularly on a daily basis needs to be this is the expectation. Because otherwise, as most parents have seen, and you will have seen at the nursery, if the child doesn't sleep properly, they wake up in a bad mood. They wake up usually quite upset. They then don't want to go to nursery. They then cause problems to the parent going to the nursery and leaving the
Yeah.
parent. That then causes a problem for the staff in the nursery because they're having to manage the child's separation from the parent. Then the rest of the day is actually set up for failure because the child is already coming in upset, distressed, tired. And therefore, you're going to see challenging behaviors throughout the day because they can't verbally express, I've not had enough sleep. I don't have a good enough routine to meet my needs. And therefore, I'm acting out now.
Yeah, and that's one of the very important questions that our teachers are asking in the morning. How was your child before the nursery? So did they have a
Yeah.
good sleep? Did they had a good breakfast? Because once we know those little details, they are crucial for us what we can expect throughout the day. And if we know there's something happening, then we kind of have the background knowledge of, okay, the morning was not so good, so maybe we need more sleep time, more breakfast. So we are prepared and we are ready to look after those children and give them the support that they need.
Exactly. And so the way I like to see challenging behavior, the way I like to imagine it is it's the tip of the iceberg, what the child is showing. So whether that be the tantrums, the crying, the hitting, that's just the tip. what is going on underneath? Is it that they've not had enough sleep? Is it that they've not had enough food? Is it that they've had a disruption to their routine? Is there changes going on at home? Is somebody unwell in the family? Has there been a new addition to the family? Have they moved house? Are the parents really upset? Has there been a bereavement in the family? All of these things can impact the child. Have they had overstimulation or understimulation through certain activities and play? Is the child naturally somebody who is quite introverted, quite quiet, and therefore finds it quite difficult in a loud nursery environment? And therefore, those needs need to be adapted to and reviewed with the parent and the staff at the nursery and the child to see how their needs can be met better. There was just one other point that I wanted to make, that when we've spoken about what the cause is, so looking at, it's called the ABC approach. It's the antecedent, which is the cause. Like I said, it could be lack of sleep, it could be, lack of food, it could be that they're unsettled from the night before. And then we actually, like I said, we look at the behavior. Are they showing an acting out behavior or withdrawn behavior? The third part is the consequences. So, how are parents managing that behavior at home? Are they actually, dealing with the child in a way that is managing the behavior to minimize it? If, for example, the parent is getting very upset and angry and frustrated, the child will continue to show that behavior. If the parent steps back and says, how am I feeling right now? What is my bodily reaction to this? What is my mind telling me how stressed I am? Maybe the parent just needs to step back to then be able to calm themselves down and regulate their own emotions to then be able to manage and regulate the child's emotions. So it's really important to kind of think about this ABC approach, really positive and positive praise for the child's good behavior and trying to ignore the negative behavior. I think I'm going to end there. Otherwise, I might go on all day talking to you
We can make
about
another one
managing
instead.
challenging behaviors.
As we wrap up today's session, we'd like to extend our heartfelt thanks to Dr. Kiran for sharing her time, expertise, and deep insights with us. This has been incredibly valuable conversation on how we, as early years professionals, can better understand to support mental health in young children. Let's take a moment to reflect on a few key takeaways. Routine matters. They offer children a sense of security and predictability, helping us observe behavioral shifts more closely. Behavior is communication. Instead of reacting, we are reminded to take a pause and ask, what is this child trying to tell me? Challenging behaviors often hold meaningful messages. Consistency is the key. In our responses, expectations, and emotional presence, children thrive in an environment where they feel safe and know what to expect. By integrating those small but powerful strategies in our daily practice, we can continue to build emotionally safe, nurturing spaces where children are not just learning, but also developing the resilience and well-being they need to flourish. Thank you once again, Dr. Kiran. We truly appreciate your time and we are looking forward to continue this meaningful collaboration.